Hello, everyone. Can you hear me and see my presentation?
Yes, I can hear you very well.
Thank you very much for joining us this morning. From Vivus, we will... let me just move my... we will present two projects actually today. I will start with a project on the community of practice to strengthen these community health workers in South Africa. And then my colleague Tony will take over to present his project, which is actually a follow-up project of this first project. This project ran from 2017 to 2018. It's already a number of years ago, but we implemented it in with a lot of partners actually. Our main partner was the University of Vhembe, and my colleague Dr. Netshikweta was actually going to present today, but she unfortunately had to cancel. So I want to take over and present this project. Just to give you a little bit of context, the partner, the University of Vhembe, whom we worked with, is located in the far northeast of South Africa, in the Vhembe district. This is a very rural area with very traditional communities, so it's important to keep in mind where this project took place. We worked in 3 rural villages that the University of Vhembe already has a collaboration with, Malavue, Nweli, and Mbahe. So these are very traditional communities that you can see in the picture, often lacking basic services, so water supply and toilets, etc. And they're economically still relatively poor communities in the far northeast of South Africa. They're also removed a little bit from the University of Vhembe. So you see a little map there on the bottom. They're only around 30 kilometers or so away from the main town, Thohoyandou, and from the university, but actually due to the conditions, it is quite a while away. So it often took us around an hour to get to these communities. In these communities, the University of Vhembe already works with community health workers. And they are basically volunteers that get basic training and education to support the community with chronic diseases and to visit clients to give them health advice. So these are the people that we wanted to support with this project. Our main goals for the first project were to empower these community health workers, or CHWs, as we refer to them. So we wanted to empower them to support their communities, as they only get basic training, and we really wanted them to get more knowledge and skills to support the community. And we also wanted to understand better the strengths and weaknesses and the health problems they encounter. For this, we set up a supportive peer learning network, the community of practice, or the COP, as we started referring to. So basically, this is a community of people, the community health workers in this case, that get together to discuss topics and to learn from each other. Our second main objective was to enable collaborative research and education between Vivus and Univan. How did we do this? We wanted to use participatory techniques, and we really wanted to learn by sharing. So this community of practice is a methodology to learn from sharing good practices between people that have a shared interest or that do a similar thing. And so we wanted to learn by sharing between community health workers. And we also wanted to use participatory methods for this learning by doing. So participatory methods are basically a range of techniques to maximize the power and the voice of the people that we are interested in, of the target group. So through using these various techniques, we wanted to really tap into this practical knowledge that is within the community health workers and that lives in their daily practice. And we really wanted to take advantage of that, of the knowledge that they already have. How did we do this? So we organized a monthly community of practice, or basically monthly. Over this 2-year period, we had 16 meetings, which was a really good result. And on average, 28 people showed up to these meetings. So these 28 participants were community health workers from these 3 villages I mentioned before. The University of Vhembe obviously brought them together in a central location every month for the community of practice to take place. And this was a different location each time. We tried to visit each community from one community to the next each month. Within these meetings, we usually had a participatory discussion on a certain topic. So that could be diabetes, hypertension, or mental health. We tried to clarify what community health workers already knew about the topic. We had a lot of physical exercises as well, energizers and mixers to keep everyone engaged and participating. And we always also had some form of top-down knowledge transfer from us or from the University of Vhembe to give them some more knowledge on diabetes or non-communicable diseases or even mental health. And we always offered lunch at the end of each meeting. So the meetings usually took place from around 9:30 till 1 o'clock in the afternoon. I'm mentioning this because it was quite important, and I will get back to that later, to also offer lunch and to do some sort of knowledge transfer. So more top-down than the participatory methods that we had envisaged. I've added a lot of pictures here to show you some of the atmosphere of these meetings. So here you can see some of the participatory discussion taking place, where we mixed community health workers from different communities together to discuss the different issues they faced. So we used a lot of drawing, mapping, prioritizing with cardboard, etc. In the top left, you can see my colleague who is doing a quiz. They really loved this type of knowledge transfer. So he did a quiz on diabetes and they really enjoyed this. It was, so as I mentioned, you can see here that we also always provided lunch. This was really important for the community health workers. To also always offer some sort of reward or some sort of contribution towards them. It was also very important. In the bottom right, you can see that we gave them certificates. This was really important for the community health workers because this made them, this showed them that they had a valued contribution, and things like that were really appreciated a lot. In one exercise, for instance, we also gave them elastic bands to use during physical exercise, because exercise is often something they are not very, they don't really use often, but this is a very practical thing that they ended up using a lot. We didn't anticipate the sorts of effects that would have, and this is one of the things that they still remember after all these years, that we gave them those elastic bands. So just to give you some context. I had a little video of an exercise, but I think on the energizers that we use as well. Apart from these monthly communities of practice, we also organized exchange visits between the universities and workshops. We had 3 workshops at Univen and 1 in Belgium. And we also organized a self-intensive program with our students that was also very knowledgeable. So the workshops and visits, we also used participatory techniques to really get the project clear and get the project's objectives clear between us and the University of Vhembe. Yeah, so these are some pictures of the workshops that we had in South Africa. And another really interesting exchange that we had was the self-intensive program. So we had a 2-week intensive collaboration between students from Vhembe and students from Univen. We stayed there 2 weeks and we worked on the research questions, what we can learn from and with community health workers on mental health promotion. And we also asked the students to prepare a good practice to share with each other in a participatory manner. So in those 2 weeks, the students stayed in the communities. They did a lot of research work, asking the community health workers about their daily practice and learning from being there in the community. At the end of the 2 weeks, we had a big event at the University of Vhembe, where we shared all the practices between each other, yeah, where the community health workers were also very happy to be received by the University of Vhembe, and to sort of, this was also kind of the finalization of this first project, where we invited everyone to the University of Vhembe and had a big ending workshop where we again gave everyone certificates. Going to the communities was also something that the community health workers really appreciated. It gave them this, apart from the extra knowledge that they gained, it was actually the connection with us as an international institution and with these white people entering the community that gave them, or they perceived this to give them more power towards their local chiefs and towards the local community. So this was also very important. So as for results, did we empower community health workers to support their communities? The community of practice is still going on, so I think that's a pretty good result. And I think we also improved knowledge and skills. This is what community health workers really took away from this experience. The thing that we didn't really achieve was this better understanding of community strengths and weaknesses. I will come back to this, but actually community health workers continue to have this preference for top-down knowledge, and it was really difficult to value their own expertise and to value, or to get them to value this expertise and to share with us what they knew. So this third result, or this third objective, was a little bit difficult for us. Also because we were far away, and then the second main objective, this collaborative research and education program between Vhembe and Univen, was definitely also something that was a good result, because, as Tony will mention later, we are still working with the University of Vhembe. As for challenges, so we had a lot of practical problems with the location of these communities. We had a lot of buses. Here you can see a picture of when we organized the community of practice, but we couldn't actually get there because the bus had a flat tire and the roads are very poor. When it rains, it's very difficult to get to a community of practice, so often they had to be delayed and we had to disappoint community health workers who were rating that we couldn't make it. There's also the community health workers often mention these, like where we try to focus on the more intrinsic value of the knowledge transfer, etc. There's actually a lot of practical and more extrinsic things that are lacking in the communities that community health workers tend to focus on. So this, for instance, the lack of equipment that they can use in their communities. There were also, as you can expect, obviously, big cultural differences. That were a challenge, a strength and a challenge, to be honest. So the hierarchical relations and power differences between us and the communities, between us and Univen, but also within the communities were sometimes complicating the process. So we always had to go through the local chiefs to do things. And relatedly, as I already mentioned, there was this very clear preference for top-down learning. So they really wanted us to tell them what to do and how to do this, which was something from a participatory angle. This tapping into the tacit knowledge and the living knowledge of community health workers was something that was difficult that was actually difficult to achieve. Another thing that was related to these hierarchical relations and our presumed power power difference was the giving of socially desirable answers. So everything was always perfect and it was always really great. So it was difficult to really understand things that we could improve on. So to learn things for the evaluation made it difficult. And also these intrinsic versus extrinsic motivations. So the one thing that really convinced community health workers to come was the idea that there would be lunch, there would be top-down knowledge, and that they had a relation with us as a foreign university, whereas we were obviously more focused on this intrinsic motivations. But this is something to take into account, I think. Lessons learned. So we had envisaged, we as a Western university or a university in the global north, we try to do things very organized and very according to objectives and middle objectives and etc. But we needed much more time and flexibility than we had anticipated, which was a big lesson for us. And also the expectation management was very, very important. So we hadn't taken into account these extrinsic motivations. And actually we needed I think going back, we would take them into account much more. Also, like the financial arrangements were very, it was often difficult, just that we had, we were responsible for, although we didn't get any money directly, but we were responsible for giving the financial or distributing these financial, and this actually made this power relationships or these power differences even more difficult to trace. So also this focus on outputs versus process. We were too much focused, I think, on outputs at the start, which prohibited us from learning much more about the process. And another lesson was this respect for local relations and traditions that we definitely needed to take much more into account than we had anticipated. I'm not sure if I have stuck to my 10 minutes, but I wanted to, I'm presenting here, but this was very much a team effort with the University of Vhembe, with the community health workers, all the communities that received us. So I wanted to stress that it was, yeah, I wanted to thank them a lot for helping us achieve this experience together. We also worked with the Institute of Tropical Medicine, University of Ghent, and the Rustenburg Institute of Mental Health here in Belgium. So as a final, before I think we will take 2 questions. Before we go over to that, I just wanted to stress that it was a great team effort, and thank you all for doing this with us. I will stop sharing my presentation.
So I think there's now time for 1 or 2 questions. Does anybody like to ask a question about this very interesting presentation in the first project? You can write it in the chat, or you can just unmute yourself. Yes, I see Justin Dosu. You can ask your question. Justin, can you unmute yourself because we don't hear you?
Okay, thank you so much. I'm very happy, glad about this project, and I congratulate you for this, and I wish a good journey for that. My first question is related to Beninese people, because I'm from Benin, and do you have any kind of projects related to this activity for the Beninese people in Benin? This is my first question. The second question is that possible to have also the slide of this presentation after this meeting? And the third one is that possible to have any certificate for attending this meeting? Okay, thank you so much.
So I think the question about the slides I can answer. Yes, we will send you the slides afterwards, as well as the recording of this meeting, so you will be able to have it. For the community talk, unfortunately, we don't have any kind of certificate for attendance. And then the first question, I don't know, Ellen, if you would like to answer it.
Whether something similar would be possible in Benin?
I guess this was the question, right, Justin?
Yeah, of course, this is my question.
Well, I'm not sure if Benin is a country that Firdouza works with, or?
Yes, we will start working with it in the next call for new projects. It will be possible.
Okay. Mm-hmm.
Yeah, I think it's also a question for Firdouza. Yeah, if you want to find partners, then you should also contact Firdouza, I think.
Yes, of course. So you can always send the email afterwards to us, and then we can help you out. I see also Ha Nguyen who has a question. Would you like to unmute yourself and ask it?
Yeah, of course. Thank you, because you answered me already.
Yes, you can ask your question.
Okay, I just want to, if the case that the project will be done in Benin, how can we participate and be the partakers there?
Well, we will put the email address in the chat, and then you can email us afterwards separately. And so we will go now to the next question. Yes, Nguyen, you can ask your question, please.
Hi. Hello.
Hi.
Would you hear me clearly?
Yes, we hear you very clearly.
Yeah. I have I have a questions because I'm from Vietnam, from Asia. So I want to have a questions related to the techniques when you conduct the project and the research. I see in the picture in your presentation, I see that in the discussion, the focus group discussion, I see it's a mixed group between the men and women, and also the participation of the foreigners. I mean that the non local people. So I would like to know that with the language you use in the focus group discussion, and is there any kind of the challenge when the involve of the non local people participated in those focus group discussion, and how the research team and also the project team could overcome those challenge?
Thank you for your question, Ha. Yes, that was something we definitely took into account. So actually within the community of practice, so when people were discussing the issues they faced, we tried to minimize the power differences. So in the small groups, we did put community health workers from different communities together, but there were no or we tried not to put people from the university in that same group so they could freely talk about the issues they faced. As for the gender difference, yes, all the community health workers were female. So we also didn't have, or we didn't have to take that into account. Obviously, there are very hierarchical gender relations as well in the community. And this is something that community health workers, that was a challenge for them when they had to give advice to men in the community. Often they weren't, they felt they weren't trusted that much. But by doing this project, they felt they had achieved more trust in the community. As for the language as well, yes, they speak local languages, so we had to work with translations. But usually the University of Vhembe did the translation during the meeting. I hope that answers your question. I think, yeah, it's important if you want to work participatory that you minimize power differences and that you try to not have this, if you work or if you would organize a focus group, it's always better, I think, not to have this hierarchical differences or power differences within the focus groups.
Yeah, could you share your experience when you work through a translator or interpreters? Because from my experience, I have the trouble that I couldn't control that the interpreters or the translator, they will interfere the researcher questions or idea through their language or their understanding. So how you can control that? And yeah,
I don't think you can control that. I think that's something you need to let go of and try and learn. This was, it's a process. So if you find that there were some difficulties with a translation, we also had a questionnaire once that we found out afterwards that was translated very differently to the way we anticipated it. But I think, yeah, it's just working with the same people and trying to get this across and trying to communicate with your translators so that you have the same idea. Yeah.
Yeah, thank you so much.
Thank you.
Okay, thank you. I think it's now, unfortunately, we don't have time for the other questions, so we have to go to the next presentations. So I would like to invite Tony to start the next presentations, please.
So, hello everyone, I'm Tony. I'm from the University of Applied Sciences, Vhembe, and I'm responsible for the second project, but it fits very well with the first project Alan told about because it's learning about from with each other, and it's also not from a top-down approach, but from a bottom-up approach. I'm very proud to talk about this project with the partners from University of Free State, University of Vhembe, and University of Western Cape. Yeah. First, let me give you a very brief introduction. So, as I already told, the idea of the second project was to support community healthcare workers from the experiences of community healthcare workers, based on the experiences of community healthcare workers, and through the idea of interprofessional learning. So we really want the community healthcare workers to become a member of a team, because we experience often community healthcare workers are not rewarded as professional team members and are struggling with that issue. So for that, we would like to involve students and the community healthcare workers in the same project to learn from and about each other, which is a very important quote by Reid in Interprofessional Education. Yeah. I would like now to invite Professor Lizzy Netshikweta, yeah, to give you more information about the healthcare workers. Yeah. So Lizzy.
Thank you, Tony. Thank you very much. This is Lizzy from South Africa, the University of Vhembe. The importance of working with the community health workers within South Africa in the rural communities. It's very important to us because we realize that community health workers are really improving the adherence of maybe medication taking and also health seeking behavior amongst our rural communities. So the real thing that we realize from the community health workers, they are supporting people. There are people living with HIV/AIDS who are unable to take care of themselves. So these women, they are able to look after these people. Those who cannot bath themselves, they also bath them in their household. They also assist with management of tuberculosis, patients who have been bedridden in their houses. So they go there and look after them on daily basis. Giving health promotion talks, that's their expertise as well. Conducting home visits for chronic patients, and where you will find that they look after the diabetic patients, they look after the high blood pressure patients, and they also look at all the chronic conditions that one cannot look after or one is vulnerable. They are responsible for that. Tracing medication defaulters, like for instance, people who were taking maybe those who are hypertensive and they are no longer following up for the treatments. These are the people who make them adhere to the adherence to the medications by following them. If they find that they are, because they have small books that they record that the patient has their supply. If not so, they will advise this person. They will even take this person to the nearest clinic where they are allocated, referring clients to the clinics where the community health worker is stationed, and assisting the parents with malnourished babies, children. They are responsible for giving them health education, as well as to refer them where they can go to the nearest primary healthcare clinics. We also, in that way, you find that our community health workers, they move around. They have what we call a delegation or a timetable, because the whole week from Monday to Thursday, they will be moving around from one house to another. Each community health worker, it's allocated to a certain area. Community health workers in our area, they also express, because when we talk to them, we go to them, we work with them, with our student, particularly the third level, fourth level student. You will find that they are indicating that when they go out there, sometimes they run short of the the gadgets. Like for instance, if you are going to the house, you must be having a mobile BP machine in order to take the blood pressure for a patient who have blood pressure, maybe high blood pressure. And sometimes you will find that you don't have. That's what we also negotiate with our government, the local government, that they should provide them with something that they can carry to the houses in order to meet the needs of the patient in the houses, in the communities. However, they portray that they reported that lack of clarity from the health system regarding the scope of practice. It's also giving them problems because they are not telling them what scope are you, in which scope are you. Like for instance, in South Africa, every nurse has a scope of practice. From the assistant nurse, they have scope of practice, and the healthcare teams also need to be educated on the specific scope of practice. And when we go out there, we also try to show them that within their fraternity where they are to practice, this is what they do. Like for instance, we realize that some might not be able to apply the ethics when they go into houses. So it is our responsibility as the university that is collaborating with community health workers. And our students are learning to teach or to talk to the community health workers and showing them what they need to do. And we take pride for that, because in each time you will find that a community health workers who is practicing, particularly on Fridays, because Fridays they are out there in the community from Monday to Friday, from Monday to Thursday. But Friday they are all reporting back to the clinic where our students are. Need to be made aware of working in spirit of mutual cooperation rather than competition with the community health workers. Scopes of practice must also be emphasized. In the community health worker, they practice internship, good practice as well. In the curriculum, we train them, and we already spoken to our education, our local government, that we are going to endorse the community health worker practices in our curriculum. And of course, it has been started. We started long ago to work with them, and also to make sure that our students are taught here and they go practice out there to apply theory into practice. And what about student community testimonies? I think this, we take video in order to make in order to make our student, what is the feeling and how do you feel? Our students are really teaching the community health workers. They are working with them. Sometimes we go around the houses with them.
Thank you, Lizzy. Thank you, Lizzy. Yeah, we are running out of time, I think, so, and we have a lot of stories to tell. So as Lizzy already told you, we ask every university involved to design an intervention in practice in the community, where students and community healthcare workers collaborate and learn from and about each other. But we also ask them to design a training in the curriculum of at the university. So it's also implemented in education. And then, as Lizzy already told, at the end we will show you some testimonials of students and some more pictures. So the next guest to speak is our partner from the University of Free State, Professor Marianne Reid, who is joined in the project by Anne-Marie Jobert. She's also here, I've seen. So Marianne, the floor is yours. I would like to suggest that we skip the beautiful movie because it's 5 minutes, but we will send it through the PowerPoint to everyone who is attending this community talk. So Marianne, go ahead, floor is yours. The good practice of the University of Free State. Okay. Can you unmute yourself, Marianne? Marianne, you're muted. She has a very wonderful voice. So,
Marianne, do you need some help, or do you succeed to unmute yourself? You can also write in the chat if you don't succeed.
Yeah, just a moment.
My apologies. My mouse did not want to react. Can I just make sure? So you're going to share from your side, and I'll just ask you next slide every time. Thank you so much. My apologies. So, good day, colleagues. It's really a pleasure for us to greet you from a very sunny Bloemfontein, in the central of South Africa, in Bloemfontein. The next slide. Yes, thank you. It's Anne-Marie Huber and myself, and I'm Marianne Reid. We are from the School of Nursing in the University of the Free State, and we developed a toolkit to support community healthcare workers through interprofessional learning on a rural platform in the Reid district of the Free State province of South Africa. So we followed various phases to develop a diabetes-focused toolkit for community healthcare workers. And the toolkit consisted of a facilitator's guide and a set of infographics used by community healthcare workers when interacting with patients diagnosed with diabetes in a community setting. Next slide. So the content of the toolkit was informed by data that was obtained from community healthcare workers when exploring data from echograms developed by them. Also, various stakeholders from the interprofessional learning platform during nominal group discussions. We did a scoping review, and we held stakeholder workshops to develop and finalize the toolkit content. Next slide. So the principles we employed during the development and execution of the toolkit included activities focusing on community healthcare workers' role in diabetic care within the interprofessional learning platform, whilst aligned to the scope of practice prescribed by the Free State Department of Health, because our community healthcare workers are employees of the Free State Department of Health. We also focused on interactive learning, working towards problem solving within a community setting. We made learning fun, whilst being as culturally sensitive as possible. Our next slide. So these pictures present some of the material included in the toolkit, and specifically also the infographics that was used. Thank you. Next slide. The training of the community healthcare workers formed part of the developed toolkit, with sessions highlighting specific knowledge and skills. The initial training ran over a 2-month period with 4 to 6 weekly updates thereafter. Next slide. As already mentioned, the nature of this training was interactive, with song and dance and traditional games and poems and storytelling forming part of our activities. That also placed Anne-Marie and myself sometimes totally out of our comfort zone, but that was part of the fun. Thank you. Next slide. So during a 6-month follow-up stakeholder meeting, the impact directly linked to the implementation of the project included patients being able to manage their diabetes complications, primary carers empowered to assist their family members diagnosed with diabetes, and patients being less dependent on clinics to manage emergency care such as hypo or hypoglycemic attacks. Some of these interviews may be shared with the audience if time allows. If not, I'm sure it will be on some platform for you to see. Next slide. Now, since the training and knowledge and skills imparted by the developed toolkit is entrenched within an existing interprofessional learning initiative of the Faculty of Health Sciences at the University of the Free State, follow-up meetings with stakeholders are scheduled on a regular basis, with the toolkit forming the basis for training not only of our own community healthcare workers, but also other lay healthcare workers in one of the towns. It actually went to the retirement villages as well. Next slide, please. So the generous funding from Flurius, strengthened by the University of the Free State's support, laid the foundation for this project. We were able to print T-shirts and umbrellas for community healthcare workers, assisting in the spreading of the diabetes message in the community. Last slide. We really want to thank you for your time, and we wish everybody best wishes if they've got similar projects that they plan for the future. And that's our 5 minutes, Tony.
Well done, Marianne. Well done. Thank you for that. So, as everyone had to design an intervention into practice in the community with community healthcare workers, we also asked every university involved to design an educational intervention. So that's why Firdouza Waggie from the University of Western Cape will give more explanation about how to implement it into education. Yeah, I will share another screen. So I can show the presentation. Firdouza's hand.
Are you going to? Do you want me to share? Are you going to share, Tony?
You can share it yourself, Firdouza, if you want. Can you share it yourself?
We don't hear you very well, Tony. I don't know. Yes, okay.
Can you see my screen?
Yes, we can see it.
Okay, so let me just get this into the power slide mode. Just move this over so I can get into the power slide mode. Oopsie, sorry. Can you just need to go back? Okay, so just basically, yeah, let me just quickly go back into that. I just clicked on the, sorry about this. Okay, cool. Thank you, colleagues. Thank you very much for the invitation, and thank you for inviting the UWC. We are very privileged to be part of this project. So my brief was basically to look at how do we implement interprofessional learning with community healthcare workers in the curriculum of undergraduate students. And I am going to present the case of UWC. Yeah. Can I continue?
Yes.
Thanks. Okay. So my presentation is basically going to look at the following aspects. I'm going to look at the community, just briefly sketch the community healthcare workers in South Africa, of the conceptual clarity of community healthcare workers and interprofessional learning. Then I want to talk a little bit about institutionalizing or the institutionalization of IPE at UWC. I'm going to just focus quickly on or present you what our model is at UWC. I'm going to also then present opportunities for learning with CHWs, and then I also want to give you the case study, a practical example of how we've integrated it into the curriculum and the scholarship that came out of that, and then lastly, some lessons learned. So just going to the next slide. So quickly, just the context in terms of community healthcare workers. So in South Africa, since 2012, we have been looking at re-engineering the primary healthcare within our health system in South Africa, and it's moving towards our healthcare services, moving towards team-based approaches. And if you can see in the red there, I've highlighted essentially the re-engineering of primary healthcare is focusing on three main teams. The one is a school-based or school health teams. The second one is at the yellow. If you look at the yellow area there, it is around the team in the primary healthcare clinic, which includes the doctor, the nurse, the pharmacist, the pharmacist assistants, the counselors, etc. But the one that we want to focus on is the ward-based primary healthcare outreach teams, which the community healthcare workers are part of. And that's been the shift in our thinking around the re-engineering of primary healthcare in South Africa. Just in terms of how we conceptualize primary healthcare, I'm not going to go into the definition of what we refer to as primary healthcare, but at UWC, we understand community health workers to be lay workers appointed by non-government organizations that are funded by the Department of Health. The community healthcare workers offer basic services to vulnerable individuals, groups, or families with the aim of improving health outcomes. In terms of how we understand interprofessional learning, we consider interprofessional learning as learning that takes place as a result of interaction, communication, and engaged reflection between the university students and the community health workers. My next slide, colleagues, just as important for you to understand the context and why IPE is so important. And I want to quickly just show you that IPE in our faculty is we are very upfront about and why it is important for us, because we've got it, for example, in our mission statement. You can see it's about collaborative interprofessional approaches, and also in terms of our key focus areas. IPE and collaborative practice is a key focus area in our faculty, and therefore, because it's a strategic focal area, we therefore have attached it has impact in terms of our curriculum, in terms of our research, in terms of our community engagement, and in terms of our resources that support the strategic objective. The next slide, colleagues, is about how we have developed an IPE model at UWC. Our model is basically an adapted version of the model that was developed by Cox et al. In 2016. It looks basically at IPE learning or interprofessional education from an undergraduate level right through till a postgraduate or till continuous professional development. And I'm going to talk about these programs specifically. I'm going to look at the undergrad program and how community healthcare workers and their training and learning can be integrated into these modules. So at the undergraduate level, so I know my slides are very busy, but if you can just follow me in terms of where we are at. So we at UWC, at our faculty, we've used the approach of a scaffold approach in terms of integrating IPE learning into the curriculum. So we look at the first year level, we've identified, if you look at this red, the ones that I've highlighted the red, these are the learning opportunities or the modules where community healthcare workers are kind of brought into and can learn with our undergraduate students. So at the primary healthcare first year level, we've identified, there's somebody that's got the volume on or the mic on, and it's getting some feedback to me in my presentation. If I can just ask the person just to mute his mic or her mic for a moment after I'm done. Then, so at the first year level, it's a primary healthcare module, very important. At the second year level, we've identified interdisciplinary health promotion, which is our second year interprofessional module. At our third and fourth and fifth year level, we've identified opportunities in our world cafes, which I'll talk about. And then also another opportunity is when we do the interprofessional education supervision in the community. And at the postgraduate level, we've identified short courses. However, we have not gotten to that point where we are developing. So my brief was mainly to look at undergraduate level, and I'm going to talk about how we've integrated it at the undergraduate level. So colleagues, for those of you that are familiar with interprofessional education, there are basically a number of core competencies, and at UWC, we've stuck to 4 main core competencies which we want our students to graduate with, and we want to extend this as well to the community healthcare workers that are going to participate in the learning process with our students. So at the first year level, like I spoke about these little ones, the primary healthcare, these are the workbooks, or these are the modules that the students are given and that they'll participate. All the learning materials are in there. So in terms of, and also if you look at the core competencies around teamwork and team-based practice, communication, roles and responsibilities, and the values of ethics in terms of interprofessional education. So these are just in a nutshell, and there's the scholarship that's attached to this. These are the articles that I've just highlighted, the main articles. There's quite a number of publications that came out in terms of our curriculum at UWC, but these are the main ones that have emerged. So let's look at the first module, colleagues. So at the first module, which is the primary healthcare module, which happens at the first year level, if you look at the content, and I'm not going to go, I know it's a very busy slide, but if you look at the content of this module, there are concepts around teamwork, teams development, around concepts around primary healthcare, social determinants of health, notions of what is a community, concepts of how to work in communities, community profiling, and then there's the issues around the ethics and the values and the human rights approaches to healthcare. All this content speaks very, very clearly to what is needed for healthcare workers and what community health workers need to can contribute with and can also learn in the process, because we are all in terms of how we view community healthcare workers, they are part and parcel of the healthcare system. They are one of the cadres of the health professions. So these, as you can see here, one of our articles that we have published on is around the co-creation of an interprofessional education curriculum using local and indigenous knowledge. So in that study, we brought the community healthcare workers and the communities into the classroom, and we basically looked at, if you look at how, with the students, how we've what the learnings are, depending obviously on when around the theme or the topic that is going to be discussed. So we've been creating knowledge with the community healthcare workers. If we look at this one slide here in terms of the presentations, the community healthcare workers and the students are presenting as a team. So for us, that is very important. The community, their voices are it's very important. Then at the second year,
I'm so sorry to interrupt. It's 1 minute after 12 o'clock, so I think we'll have to finish up. Maybe I can give you 1 more minute to wrap up your presentation.
Okay, so colleagues, that is our second year module. That's our third year module, the World Cafes. I just want to take you to the lessons learned. Allow me just to go to the lessons learned. I know I've got very little time, but just in terms. So just for the lessons learned, there are 8 points that I think is very important in terms of the lessons learned. The one issue is that we feel that interprofessional learning must be institutionalized. The second issue is that we need to foster interprofessional or collaboration and teamwork at all levels in the institution. The third point, I think, which is very important, is the acceptance, the recognition and understanding of the role of the community healthcare worker in the healthcare system and in the healthcare team. We need to be very intentional and strategic when we choose the learning opportunities for the IPE, for interprofessional learning with the community healthcare workers. We also feel number 5 is that the learning must take place at the university as well as within the community. And then also importantly is that in terms of the acquisition of the learning outcomes and the competencies, it must also be not only for the students, but we also need to focus on the acquisition for the community healthcare workers. Therefore, we also need to assess the learning. And then importantly, number 7 is to listen and understand what are the learning needs of the community healthcare workers instead of using them to assist university students to achieve their learning outcomes, because that is what's traditionally been happening. The community healthcare workers, they take our students, they go out into the community with the students, and our students achieve the learning outcomes, but not the community health workers. And then lastly, importantly, number 8, is to continue with the building of relationships with the community health worker organizations and plan IPE learning collectively. So colleagues, sorry about that. I am I ran a little bit out of time. I will share, Tonya has my presentation. We can share it with everyone. But this is basically our case study from the University of the Western Cape. I just want to thank you so much for giving us the opportunity to present our work that we've been doing at UWC. Thank you, colleagues.
Thank you very much for this very interesting presentation. So yes, I would like to thank everyone who presented today. I think it was a very interesting community talk. I also saw some discussion and questions in the chat, so that's very nice to see that you already exchanged a little. So we will send the presentations to everybody. So you will all be able to see it and the videos as well. And then finally, I would just like to say, I saw a few questions in the chat about, is there any projects that we do in another country with a similar topic about community healthcare workers? So we as Firdouza, we do not organize this project ourselves, but we fund universities which want to do the project themselves. So if you would like to start your own initiative, I can refer you to our website, which has more information about the possibilities. Next week, there will be a call which will be launched for new project proposals. So you always need a partnership between a Flemish university and a university in another country. There's a list of 17 countries which are eligible. So I would advise you next week, keep an eye on our website, and then you will be able to find all the information to start your own project. And then I think now it's 5 minutes past 12, so we are a little bit out of time. So I think we need to wrap up. Yes, Tony?
So in the presentation, you will find some testimonials of students, and some pictures of the community healthcare workers. What I also would like to announce is that one of our project goals was to develop a movie. So we are very busy of making the movie. So we expect the movie to be ready and to be launched by June. Yeah, so maybe we can do something about that. And I saw also a lot of questions about future projects. So if you're interested, please send us an email if you're interested in projects on community healthcare workers, on interprofessional learning with students. So send us an email, but I will also send an email to every participant to find out if there are more questions or what opportunities are for future projects with Firdouza.
That's great. So everybody can get in touch afterwards. Then I would like to thank you all, and I hope to see you in our next community talk. Bye, everyone.
Bye-bye.